Hi everyone, Hannah here, and if you are new, I do travel vlogs and PawVlogs videos about my dogs. In this video, I will share to you why Cookie is peeing blood in her urine, and there's a jelly-like blood that has crystals in her vagina after she pee. So another story time. It all started last December 7, 2023, last year, when we saw that there's a little blood in her urine and in her private part. By the way, I am sorry for my voice because I have a cough and have a runny nose, so pardon my voice. I will put the picture here of Cookie. It is like jelly type in her private part. We are very worried since that is not normal, of course. And if your pet is experiencing the same, that there is a spot in their urine, immediately go to your nearest vet to know their real condition. Of course, that is my suggestion as a fur parent. So on that day, December 7, 2023, we immediately went to the nearest veterinary clinic. So that's around 6 or 7 in the evening. They immediately ultrasound Cookie and they got a blood to perform CBC. They said that there's a wound in Cookie's urinary bladder, which is the reason why it is bleeding. I will show to you the next clip where we went to the hospital and the doctor is checking Cookie's urinary bladder.
Sugat yung pantog niya po sa loob. Walang laman yung pantog niya po pero may sugat. May nagdudugo sa loob. Ayan. Pantog sa loob ng pantog, may bleeding talaga. Active bleeding siya kapag ganyan. May mga crystals din. Nakita niya parang linya-linya ng crystals po yun.
And it is confirmed that there's an active bleeding. They've seen something glittery, which is the crystals, which causes the bleeding of Cookie's urine while peeing. The doctor gave us treatment plan. I will also share to you what kind of medicine they gave to Cookie. I might make a separate video of how much it cost for Cookie's check-up and the follow-up check-up and all her treatments and medicines for Cookie's urinary bladder and UTI. I will also put the result here of her CBC, and they diagnosed Cookie that time that she has urinary tract infection. They prescribe Royal Canin Urinary SO. I will also make a different video of how much we paid for the medicine and the checkup for the month of December 2023. So watch out for that because I will share the specific price and much more detailed. Then December 8, 2023, we collected a urine sample of Cookie. By the way, again, I will also make a separate video of how we collected urine sample of Cookie. Since she is a toy poodle and a small breed, it is kind of difficult to collect a sample urine because she is a small dog. And also, how much is the urinalysis? The vet gave us a urine bottle. After we collected the urine, we need to bring it at least within 30 minutes. But if, for example, within an hour, you already collected the urine of your dog and you cannot go to the vet immediately, the vet advised us that we need to put it first in the refrigerator, since it might not be accurate if it is more than an hour. So after we collected the urine, I went immediately to the vet. I've seen the urine of Cookie that there is indeed visible crystals. I will also put the picture here. Then we are expecting to know the results after 24 to 48 hours. But it's been like 2 days, but there's no update from the veterinary clinic. They said that they will email us and message me, so we follow up and call them again. What happened is they forgot to submit it to the lab and the urine is already diluted, which is the fault of one of their staff. That is why we need to collect again a urine sample of Cookie for the second time. Since it is their fault, they paid the Lalamove to be delivered in their clinic. We kept monitoring Cookie, like how many times she pee, and if there's still blood in her urine and in her private part. Then December 12, 2023, they emailed regarding the result of Cookie's urinalysis. It says there that there's a few bacteria, there's a crystals, uric acid, and amorphous urates. The diagnosis is that there is a urinary tract infection and urolithiasis. They recommended to continue the prescribed medicine and follow-up check-up after 2 weeks, and still maintain her urinary SO, the Royal Canin, which is expensive. So December 13, 2023, they emailed for Cookie's additional medicine. Since we already know the result of the urinalysis, there's 2 tablets added, the Methiovet tablet for urinary acidifier and the Ruatinex. Actually, that is for human, as well as to dissolve and break down any crystals or stones. So December 18, I bought the 2 additional tablets and still continue to give Cookie Renacure for 30 days and should be strictly on urinary SO diet for 30 days. After 14 days of medication, they noted that Cookie needs to have a urinalysis again. If we are already finished or I am finished giving all the meds that they prescribed, then what happened is, since I fed Cookie once a day before, we need to adjust it since she needs to drink her medicine twice a day. But sometimes she doesn't want to eat in the evening. So the other medicine, since it should be taken after meal, I'm just giving it once a day because she doesn't want to eat at night. It kinda delay the medicine. Then fast forward, it is December 29. I've seen again a drop of blood in Cookie's urine and in her private part. I'm not sure if it is because I'm giving the other medicines once a day. So the next day, December 30, 2023, I went to the vet to buy the remaining Ruatinex that Cookie needs to take. I also asked the doctor what happened, that I've seen a little drop of blood in her urine again, and I also asked, is it because I'm giving the other medicines only once a day, which he prescribed it should be twice a day. He said no, but much better to force feed her in the evening so Cookie can drink her medicine twice a day. It should be the last week of December 2023 for Cookie's follow-up check-up. But we are not done yet with her medicine. That's why I force-feed her at the evening for her to eat and drink all her meds. Then, first week and second week of January 2024, I've noticed that every time she pee, for example, in the morning, her first pee doesn't have a urine. Then, on the second attempt, there's already blood coming out and a jelly blood-like again in her private part. And take note, that happened consecutive days. Are you okay na? Good job! I am closely monitoring and observing so that I can also show it to the vet once we went for a follow-up checkup. That's why every time Cookie pee, I'm worried and afraid if there is blood again. Then January 17, 2024, we collected another urine sample from Cookie if there is an improvement for them to test again for her urinalysis. Since we already finished all her meds, we can have a urinalysis test again. And so far, on that day, January 17, 2024, that is the last time that I've seen Cookie that there's a blood in her urine. And until now, February 11, 2024, so far so good. I haven't seen any blood. Cookie is already active, unlike last month, last January. And also, I haven't seen any jelly-like type in her private part. I also bought on that day, January 17, a sambong tablet for Cookie. Take note that it is not prescribed by our vet, but we consulted a different veterinary doctor in our province. Sambong tablet is also a medicine for humans, which is much cheaper than the prescribed medicine, which is the Renacure that has a sambong leaf as well. And sambong tablet is used as an anti-urolithiasis. So I started giving Cookie only 1/4 tablet of sambong, and it started last January 17, 2024 in the evening. Then January 18, we called the vet if they already have the result of the second urinalysis of Cookie. We spoke to the doctor and he also called us and explained the result of the urinalysis. He said that the urinary tract infection is gone, which is a good thing, but there is still crystals. And it seems that it became a little bigger, which is called the Struvite. And he said that he needs to correct the bladder and he wants us to go back the next day for Cookie's follow-up checkup. So January 19, they ultrasound the abdominal part of Cookie and another CBC, the blood test. So again, another expensive bill.
Ano ba to? Kidney, mga crystal sa loob, kaya nagdudugo. No? If hindi na kukuha ng gamutan, and then naalala ko si Urate next, parang natigil for 1 day. Tama ba?
Hindi naman natigil. Minsan, once a day.
Oo, yun. So, ayan, hindi niya pa na-break doon ng maayos, kaya tuloy-tuloy yung dugo talaga. Spotting talaga siya. Kumakas kasi mga bato ang dami, no?
Black?
Yeah, yung pantog niya. Kaya siya black kasi water siya.
Oo.
Ayun, mapansin mo parang, ayun, nanganokal. Parang, ayun, this one. Yung mga yan.
Oo.
No, those are blood clots, yun yung nakita mong gel. And then yung white na kumikinang-kinang na yan, those are stones.
Super dami po.
They've seen that there is still stone in her urinary bladder, and they check the other organs of Cookie, like the liver and the kidney, and they are okay, which has a normal size. But the urinary bladder is still inflamed and there is still crystals. Well, crystals and stones, as explained by the doctor, is just the same, but it is different on the sizes. The crystals are like salt, while the stones are much more bigger. Also, yung labasan ng ihi ni Cookie, okay naman daw sa ultrasound, walang nakabara. I will show to you guys the second blood test result of Cookie's CBC, and the doctor gave new medicines like the cyst aid for her bladder to be healthy. And he wants to repeat again that Metayovet and Urate next for another 14 days. But since it is not available on their clinic at that moment, and cotrimoxazole, which I bought. By the way, after we got the results of Cookie's second urinalysis, I researched all about Struvite, and I will put all the links of the videos that I watch on the description box. I will share it to you because this might help you if we have the same case. Then, February 7, 2024, we went to a different veterinary clinic, a bigger veterinary hospital. Actually, that is where Cookie got her surgery last 2022 for her closed pyometra, because we want to have a second opinion and we want to know if there's already improvement, since I haven't seen any blood in her urine. But our main purpose, that is why we went on that specific and bigger veterinary for her eyes to get checked. And I will also make a separate video regarding her eyes because it got whitish or bluish already. And take note, Cookie is already a senior dog. And we also consulted regarding her urinary bladder and the crystals, which I told him everything, that Cookie was diagnosed with UTI and urolithiasis. The doctor immediately conducted an ultrasound, and thank God that her urinary bladder is already clear. That is why the doctor congratulated us. He advised us to continue the urinary SO and the sambong tablet because it is just herbal and Cookie doesn't need to take the Ruatinex. Kasi what happened is 5 days ko lang siya napainom ng Ruatinex, and yung Metayovet is hindi ko pa siya napapainom. At that time wala talaga silang medicine, so hindi ako nakabili until nag-stick na lang kami sa sambong tablet. And the doctor advised me that if I were her, the urinary SO will be Cookie's maintenance. But of course, it is still expensive than the normal dog food or the normal Royal Canin. I think we will stick to that since Cookie is already a senior dog. Until now, February 11, 2024, Cookie is much more active, no more blood in her urine, and her only problem is her eyes. But we cannot do anything because it is part of aging. And again, I will make a separate video on that.